How did he find out about the brain? By Isaac Asimov. Read by Rogério Fonseca. Trouble with the brain. Once it became quite clear that the brain and the spinal cord control the body's motions and senses, it was possible to wonder what would happen if the brain didn't do its work properly. What if the brain were disordered or diseased? If someone's brain stops working to any considerable extent, he may suddenly fall unconscious. This is called stroke or apoplexy. After all, it might seem to people who knew nothing about the brain that someone suffering a stroke had actually been struck down by some invisible being, a god or a demon perhaps. A stroke may lead to death, or it may leave a person alive but paralyze a portion of the body and make it unable to move. Nowadays, we know that a common cause of a stroke is that one of the small blood vessels in the brain is blocked or breaks, so that part of the brain doesn't get oxygen and dies. Sometimes there are less drastic disorders of the brain. Some people occasionally make involuntary movements. Suddenly they fall down, twist and turn, make strange sounds, or froth at the mouth. They may also see and hear things that other people don't. To hear or see something that isn't really there is now called hallucination. In ancient times, people thought that those who hallucinated were actually seeing and hearing an invisible world. Perhaps they were receiving messages from the gods. Perhaps gods took over the body and made it move uncontrollably. This seemed especially true when people who fell down and did all these peculiar things then recovered and seemed perfectly normal again. Such a condition is sometimes called the falling sickness. The medical name is epilepsy. It was as though the gods had seized you and temporarily taken over control. The ancient Greeks called epilepsy the sacred disease, and people who suffered from it were sometimes viewed with awe. Since these people were thought to be giving glimpses of the future, they were often considered to be prophets. Almost anyone who behaved in a curious fashion, whose speech and repetitions behavior didn't seem to make any sense, was treated with similar awe. In later times, such people were called madmen or insane. Insane is from Latin words meaning not health, that is, not health in one's way of behaving and thinking. These people were also described as touched, that is, touched by some god. So long as people thought gods were involved, those who suffered from epilepsy or insanity were treated with kindness and consideration. As time went on, though, more and more people began to think it wasn't a god but a demon who controlled the bodies of epileptics and madmen. Therefore, the demons had to be driven out of the body before a person could be restored to health and sanity. Sometimes the methods thought to be useful in driving out the demons were very cruel. People who acted insane were beaten, chained up, and in many other ways mistreated. They were locked up in insane asylums where their condition would simply grow worse. Sometimes, people who considered themselves sane would go to such asylums just to watch the odd things that mad people did and to laugh at them. Of course, not everybody thought that gods or demons had anything to do with what we now call mental disorders. Throughout the centuries, there were occasional doctors who said that insane people were sick and should be treated with consideration instead of being tortured. The Greek doctor Hippocrates and those who followed his teachings insisted that epilepsy was a disease like any other. They said it had natural causes and it would be relieved by medicines rather than by prayers or beatings. Another doctor who thought this way was a Greek physician named Soranus, who lived in Roman times and who classified various types of mental disorders. For the most part, such reasonable advice was not listened to. People continued to believe in demonic possession. In 1789, the French people rose against their corrupt and inefficient government in a movement known as the French Revolution. Over the next few years, the revolutionary leaders were willing to try a number of new things, such as new measuring system, new calendars, and so on. They were willing to try a new way of treating the insane too. A French doctor, Philippe Pinel, was another of those who, like Hippocrates and Soranus, studied mental disorders and favored gentle treatment for the insane. In 1793, Pinel was put in charge of a large insane asylum. Most of the unfortunate people in the asylum were kept chained up, some of them for many years. Pinel took the chains off the patients, cleaned them up, and tried to make them comfortable. He studied each case and kept records of developments. It turned out that the insane improved greatly in this way. Pinel started a new fashion in the treatment of the insane, but things improved slowly. In country after country, however, in England, in Germany, in the United States, gentle treatment of the insane caught on. By the end of the 1800s, the old, cruel ways had vanished in civilized places. Meanwhile, how did one treat mental disorders? If the brain wasn't working properly, was there any way of making it work better? Almost anything might make the brain work better. The world is full of sights, sounds, smells, tastes, touches, and even thoughts that reach the brain, and any of these might soothe it or somehow change its action. If a person believes that something will make him feel better, that something may really make him feel better, even when something is wrong that doesn't involve the brain, the way the brain works might affect the disorder. It may make the disorder worse or better. Suppose, for instance, that a person has a problem. A friend tells him that there is a special charm that will cure him, or that gods and demons can be called in to cure him. The friend then mumbles strange words over the sick person, or he makes gestures with his hands, or he just touches him. If the sick person believes he will be helped, if he has faith that he will be helped, he sometimes is. This is called faith healing. As time went on, and people learned more and more about how the body works, faith healing didn't seem to be enough. People wanted to be cured by something that was scientific. In the 1700s, scientists were studying the way magnets and electricity behaved. Both magnets and the electrified objects could attract things, and many people believed these objects could be used to attract diseases and pull them out of the body. Around 1774, a German doctor named Franz Anton Mesmer, working in Vienna, Austria, actually tried that. He passed magnets over the bodies of his patients and tried to pull out the disease. It sometimes seemed to help, and mesmerism became quite fashionable. The magnet, of course, had no real effect on the disease, so it was only another form of faith healing. Mesmer found that he could even leave out the magnets and just pass his hands over the patient. They might be helped in this way too. However, a good many patients weren't helped, and they complained to the police that Mesmer was a fake. Mesmer was forced to leave Vienna, and in 1778 he went to Paris. In Paris, he was quite successful for a while, but then the same thing happened, and in 1785 he was forced to leave Paris. Mesmer wasn't a total fraud, however. He was just too enthusiastic, thinking his methods could cure any disorder. After his time, there were others who practiced mesmerism. In 1841, a Scottish doctor, James Braid, attended an exhibition of mesmerism. He began to wonder if there might not be something to it. He felt that in those cases where it seemed to help a sick patient, it must do its work by affecting the brain. He experimented and found that if he had a patient concentrate on a sensation that was dull and repetitious, the patient's brain seemed to get tired, and he stopped paying attention. It was as though the person had gone into a kind of sleep and was no longer aware of many things about him. Braid called it hypnotism, from a Greek word for sleep. Hypnotism wasn't real sleep though. The hypnotized person could still hear what was said to him. With the conscious mind sleepy, the unconscious mind underneath was very receptive to suggestion. It believed things much more strongly than the conscious mind would. Thus, if a disease could be helped by addressing the brain of a hypnotized person could have even a stronger effect. Doctors began to use hypnotism to treat mental disorders in particular. One such doctor was Austrian Joseph Breuer. In 1880, he found that a hypnotized patient seemed to remember events that the patient could not remember when not hypnotized. These memories were buried in the unconscious part of the mind, perhaps because they were too unpleasant or embarrassing to remember under normal conditions. These unconscious thoughts and memories might influence the patient and make him behave in strange ways. Breuer believed that if these thoughts and memories could be expressed while the patient was hypnotized, and if he were told to remember them after he came out of hypnotism, then the patient would know the reason for his strange behavior and could stop. Breuer discussed this with another Austrian doctor, Sigmund Freud. In 1887, Freud tried this hypnotism technique on his patients and found it worked. In the 1890s, however, he found that he didn't have to use hypnotism. If he just let the patient talk about anything he wished, so that one thing reminded him of another, which reminded him of yet another, this is called free association, the hidden memories would eventually pop out. Freud also thought that the hidden memories could be expressed in dreams, when the conscious mind was not in control. He felt it was important to remember dreams so that their meaning might be analyzed. Freud's methods were called psychoanalysis, from Greek words meaning to take apart the mind. His work had a great deal of influence on the treatment of mental disorders, and eventually a number of different psychoanalytic systems were developed by different psychoanalysts. Even with the gentlest treatment, people with mental disorders sometimes grew violent and dangerous. They would then have to be tied up or treated with strong drugs that put them to sleep. In 1952, however, a new group of drugs was discovered, called tranquilizers. These quieted a person, made him tranquil without putting him to sleep. Such drugs made it far easier to handle patients who might otherwise be violent.